I'm glad to welcome everyone. This is Dr. Basil Chaika, and today we're going to talk about the pancreas. We'll discuss what you need to pay attention to when the pancreas starts to decrease its function and when these conditions can become dangerous. Let's get started. So, first we need to start with the anatomy where the pancreas is located, because people often get confused and think it's only on the left side. The pancreas has a so-called head and tail. The head of the pancreas is located along the midline, right here, a bit to the right and above the navel. So, for example, when children often experience pain above the navel, you should know that this is one of the signs of pancreatic dysfunction. Next, the pancreas extends upward like this to the left, and in fact, this entire area is the pancreas. The pancreas itself has a number of specific functions. For example, it produces certain substances which is called its exocrine function. And in this case, these are substances that help digest and absorb proteins, fats, and carbohydrates. All these substances cannot be absorbed in our body without the enzymes of the pancreas. Our pancreas also produces other substances that are directly synthesized into the blood. In this case, these are insulin and glucagon. It is precisely these substances. They control the level of sugar in our blood and the glycogen reserves in our muscles. Therefore, based on the functions of the pancreas, these are enzymatic and actual sugar control. We can suspect changes. For example, often when we don't have enough pancreatic enzymes, or, for instance, they may be inactive, our digestion is disrupted. How do we detect this? For example, a person goes to the bathroom in the morning and the stool constantly sticks to the wall of the toilet bowl. And so you always have to use the toilet brush. That is, stool sticking to the wall of the toilet bowl is already the first sign of impaired enzymatic activity of the pancreas. Next, for example, the abdomen becomes bloated because there aren't enough enzymes to digest proteins, fats, and carbohydrates, so fermentation occurs. Also, for example, one of the signs is the appearance of pain. These pains can migrate, or often there are also pains of a girdle-like nature when they occur like this. The reason for these pains is that here on the sides, on the right and left, at the level of the 5th to 8th ribs, there are so-called projection zones of the pancreas. What is a projection zone? A projection zone is when an organ has a connection with an external area on the body. And so, for example, if the function of the pancreas is disrupted, we can detect these projection zones. They will become active. For example, dryness on the elbows, right here, that appears, is a sign of pancreatic dysfunction. And you can easily check this. For instance, with diabetes, there will be pronounced dryness here, and the elbows may even crack. Also, these are pains that occur in the muscles on the inner surface of the thigh, about 2 to 3 centimeters above the knee. When there hasn't been any injury, but for some reason a person wakes up and it starts to hurt there, and you don't know why, that's actually the projection area of the pancreas. Therefore, when disorders occur, this area will become active. Also, what other changes can happen? For example, a black tongue or a black coating appears on top. This is also a sign of pancreatic dysfunction. So, in fact, we can use these symptoms as a guide. Well, of course, there are also laboratory methods, such as detecting neutral fats in stool or conducting blood tests. We look at the activity of pancreatic enzymes and so on. But all of this is diagnostics. But the question is, what should we do? Because yes, we found something, so what do we do next? Let's break this down for you right now. I am always convinced that only a comprehensive approach allows people to be healthy in today's world. This is when we create optimal conditions on the physical level. So, when problems with the pancreas arise and we detect them, for example, bloating, stool sticking to the toilet, or undigested food remnants in stool tests, of course, we need to pay attention to the pancreas. And a gastroenterologist, or as is now trendy to say, a pancreatologist, will start giving you recommendations, will start prescribing enzymes, and, for example, your condition will improve. But what is the main mistake? It's that they don't tell you the most important information. Pancreatic enzymes are secreted in an inactive form. And it is the bile, which contains bile acids, that activates some of these enzymes. Pancreatic juice also activates some of the pancreatic enzymes. In other words, the enzymes are activated in the lumen of the duodenum. Therefore, in most cases, the issue is not enzyme deficiency, but rather insufficient activation of these enzymes due to, for example, impaired bile flow. And it's a misconception that when we see a bloated abdomen or impaired absorption of nutrients, we immediately blame the pancreas. In reality, the pancreas is functioning well. The problem is impaired bile flow. That's why you should pay particular attention to the function of the gallbladder. relieve the spasm of the gallbladder, perform visceral therapy, and then add foods that will stimulate bile flow. These are spicy and bitter foods. Sour fermented foods as well. For example, the same fermented apples, fermented tomatoes, sour pickles, and sauerkraut. All of this helps. But some people say, I feel bad after eating these foods. So please consume them in small amounts, just enough to feel comfortable. Because it's a mistake when a doctor says, you can't have this, it will destroy your pancreas. It does not destroy the pancreas. It creates conditions in which the pancreas cannot function properly. This is the main mistake. That is why, through a rational diet and normalizing the function of the gallbladder, we can restore the activity of pancreatic enzymes. And on a physical level, this will actually be enough. But there is another very important point when we talk about the pancreas, because we know that there are two problems in the body. These are physical and emotional. There is also an emotional component. And the essence of this emotional component, which concerns the pancreas, since it is responsible for digesting all substances, is about events that a person perceives or views from the perspective of, I can't digest this. This is very unfair to me. For example, someone was promised a promotion and they were already expecting a higher salary or a higher position, a new position, and life would change. But then at the last moment it was cancelled. Or, for instance, they agreed with their brother to split the house 50-50, but, for example, that didn't happen. Or, for example, a man expected one thing from a woman, but it turned out to be completely different. That is, in all situations where you expected something, but things didn't turn out the way you wanted, and now you can't come to terms with this situation, it will affect the functioning of the pancreas. Other situations are when you express anger and aggression. You feel uncomfortable, you are aggressive. Why? Because when you are aggressive, you need more nutrients, and it is the pancreas that will start producing more digestive juices. So, in fact, controlling your emotions, staying calm, and avoiding these expectations allows you to normalize the functioning of the pancreas on an emotional level. Very simple methods are used. This is emotional control, and on the physical level, controlling your diet, let your pancreas be healthy, and there won't be any problems. And of course, you'll need to visit doctors less often. That's the downside of this kind of treatment. This was Dr. Vasil Chaika with you.